helping us level up, helping us thrive. Yeah, Mr. Caruana, we'll never forget.
Alright, so in this video we are going to go through our last one being SDG 11, Sustainable Cities and Communities. So by definition, SDG 11 focuses on making cities and settlements inclusive, safe, resilient and sustainable. It promotes access to green and public spaces, sustainable transport systems and affordable housing, reduces environmental impact of the cities such as pollution, waste management, etc. And it does enhance disaster risk reduction and climate resilience. So these are the overall goals and targets of SDG 11. We'll rub this off and then we'll go through the evaluation. Alright, so how is SDG 11 being applied in other communities? So SDG 11 application is designing, modifying and maintaining infrastructure, transport networks and urban spaces to make healthy behaviours the default or the easy choice. All right? So you don't need to think about what can I do in this situation to be healthy. It's just the basic one. So looking at our Healthy Cities Illawarra campaign, so we've got the Play Illawarra and the Active Transport initiatives, which have mapped over 270 public playgrounds for families to engage in to encourage that active recreation time, not only before school, after school, but on the weekends as well. They also worked on the Safe and Active Routes to School campaign and the More Than a Cyclist campaign, to encourage safe and active transport to school and or to work. So those people living in the city can obviously get to and from their needs to do in an active way, and that is obviously going to encourage that lifelong physical activity. In Western New South Wales, we've got expanding telehealth services and mobile clinics to bridge those transport barriers, particularly for remote settlements with people who may actually really struggle to get to a city to get checked out. Alright, so what lessons can be learned from other communities and applied in our own? So the physical environments must be purposely structured to enable incidental movement and social connection rather than relying solely on individual motivation. So this is something that we can learn going forward, but we do know already that there's a lot of infrastructure already in place, which is why in the previous slide we also mentioned that infrastructure can be modified for the ongoing needs. So in our local context, Lake Macquarie, Newcastle area, so I've got two things here for you. So inter-council infrastructure integration connects active travel pathways across city boundaries, creating viable commuter routes and reducing vehicle dependency, such as our Fernley track, all right, which starts in the Lake Macquarie City Council area and it extends all the way through to Newcastle City Council area. So the two councils work collaboratively to ensure that people can access that track easily. Getting to that track actually has active pathways in itself, and then they take co-ownership of looking after and maintaining that track. And it's used by not only workers, but also school students as well. Secondly, increasing development of aged care facilities co-located with active infrastructure, making physical activity and social connection easy, all right? Such as the R-Care facility at Warners Bay. So there are many aged care facilities going up in our area. I think we did a count once last year. I think it was like 6 in about a 5-kilometre radius, all currently being built or have finalised just being built. And a lot of them are around our active infrastructure areas. So this facility in particular, it's about 200 metres away from the massive walkway that goes all the way around this section of Lake Macquarie, all the way up to Boolaroo and Toronto, etc., and down towards Belmont. So people who are at the facility can easily access the pathway. They don't need to get transport to get there. They can literally just walk out the front of the facility, get on the track with a friend and just, have a yarn, have a nice walk around the lake in a nice environment. So what are the major health issues for our community? So this automobile dependence, so everyone's in a car, there's more and more cars on the road every day, and there should be less and less cars because people should be getting smart about this and carpooling or taking more public transport, but it's just not happening because of the lack of infrastructure, right? So this automobile dependence directly adds to sedentary lifestyles, illness, social isolation, and environmental hazards. There are a lot of people who wake up in the morning, they get themselves ready, they get in their car, they drive to work, they don't talk to anyone. They get to work, they work at their office desk all day, and they, have a chat here and there with some people, maybe no one, depending on what type of job they do. They get back in their car, they drive back home again, and they go home. And the whole time, they're alone, they're sitting down. It's not healthy, okay? So we look at our Lake Mac Newcastle area. So I've mentioned most of these in previous iterations of these SDG videos, but we've got higher rates of obesity, CVD, mental health, and loneliness issues in the area. Also an added one for this particular video, the road risk of cyclists and pedestrians, because unlike other city areas, we actually don't have dedicated, cycle lanes or dedicated pathways everywhere that follows roads. Like, yes, we have some great things like the Fernley Track, but the Fernley Track doesn't take you everywhere. In other communities, if we look at issues related to SDG 11, so if you consider Western New South Wales, they lack transport, okay? Transport infrastructure and also active transport infrastructure, which correlates with those higher rates of chronic disease and preventable hospitalisation. So people don't get checked out before they get too sick and then they need to go to hospital, whereas they could have got checked out earlier and it all would have been fine. All right, so what strategies are needed to implement SDG 11 successfully? So all strategies need to focus on policy advocacy and infrastructure that creates safe, green, well-connected urban environments. All right, so making sure that individuals are able to access these areas and enjoy their space in the city without having to use public transport and or their own cars, etc. So active transport infrastructure is one such program, so expanding dedicated paths and cycleways to promote active commuting, and inclusive public green spaces, so by upgrading playgrounds, parks, sporting fields, ovals, etc. to encourage active play. In our local area, so looking at Lake Macquarie Newcastle area, we've got our expanding cycle and walkway paths to connect key hubs. So we do have quite a lot of great paths in the area, but there's not a lot of connection between them. So at the moment, the council is working to connect these hubs, such as making connections between the University of Newcastle, Charlestown, Glendale, major hubs and cities, trying to make cycleways to join them all up. Secondly, we've got the Newcastle Coast Walking Revitalisation Program. So that's been ongoing for a few years now and still going. So all the way from Nobbies down towards Merriweather, making that pathway that goes all the way along and then along the harbour and foreshore area too, making that a nice place to walk as well. So how do we know if these strategies have been effective? So effectiveness is measured by tracking environmental usage against built infrastructure rollouts. In other words, as infrastructure is either maintained, modified, or added, if that then increases usage, then that's a really great indicator that it was worthwhile. We can track this data through automated shared path counters. So they're like little string, like rubber string lines that run across pathways. You see them on the roads as well, and they just count as things roll over or walk over them. We can also use that alongside epidemiological data in an area. So let's see like CVD patterns, rates of overweight and obesity. We can also use census data to look at physical activity, like so people are electing that they do activity outdoors. And finally, transport emission data, because that's a really good sign that people are using these pathways and cycleways to commute to work and school, etc. So if transport emissions go down, census and epidemiological data shows there's been a change in health status and the automated shared path counters go up, then that's a really great indicator that the strategies have been effective. So in summary, applying SDG 11 is an exceptionally potent preventative mechanism. Reshaping the physical environment creates permanent passive health benefits, regardless of socioeconomic status. However, this infrastructure requires massive capital investment and long-term construction and does not address current acute health concerns. And that'll wrap us up for SDG 11, Sustainable Cities and Communities. Thanks.